Hello everyone, welcome to Radiology cases tutorial. Today we are going to discuss benign renal neoplasms. In this video, we will discuss the angiomyolipoma, oncocytoma, and multilocular cystic nephroma. Now, first of all, we are going to discuss angiomyolipomas. As the name implies, angiomyolipomas are the tumors that are composed of dysmorphic vessels, smooth muscles components, and mature fat, and they belong to a family of perivascular epithelioid cell tumors, and they are the most common benign renal neoplasms and are second only to the renal cell carcinoma in overall frequency of the renal tumors. The classic sonographic appearance that is seen approximately 80% of the time is a homogeneous, well-defined cortical mass that is anechogenic as renal fat. Although a homogeneous, highly hyperechoic mass is very suggestive of angiomyolipoma, but approximately 10% of the renal cell carcinomas can mimic this appearance. The one distinguishing feature of angiomyolipomas that it shows some degree of acoustic shadowing. The cystic components and the calcifications are very rare in angiomyolipomas, but these are the strong features of renal cell carcinomas. And now we are going to discuss some cases in the different patients of angiomyolipomas. Now in this sonogram, we can see the hypoechoic renal cortex and its inner hyperechoic renal medulla due to fatty structures. And here we can see a small peripheral hyperechoic mass, and it shows a wedge shape, and it is very common small peripheral angiomyolipoma. And same as the case here, we can see a hypoechoic structure that is the renal cortex and inner fatty structures that is the renal medulla, but a peripheral well-defined hyperechoic mass that is angiomyolipoma. Now here we can see the shadowing associated with angiomyolipoma in a patient. This is the longitudinal view that shows a large solid hyperechoic mass that is only shows detectable sound attenuation at very high frequency probe, and the longitudinal view with transmit frequency is set as about 4 megahertz. And here we can see a longitudinal view of the kidney, and it shows a small hyperechoic well-defined mass that shows a detectable sound attenuation at a very high frequency, and its acoustic shadowing is clearly visible in the sonogram. These findings are suggestive of angiomyolipoma. Now we are going to discuss another benign renal neoplasm, that is the oncocytoma. And oncocytomas are a type of renal adenoma with large epithelial cells that are rich in granular eosinophilic cytoplasms. Their sonographic appearance is generally non-specific and overlaps with the renal cell carcinoma. And in the sonogram, we can see a large mixed echogenicity area that is predominantly hyperechoic, that is present at lower pole of the right kidney, and it has well-defined margins, and it is indistinguishable from the renal cell carcinoma. And in this sonogram, we can see a power Doppler view that shows a solid mass with internal vascularity that is arranged in a spoke wheel pattern. And in both cases, the appearance is indistinguishable from the renal cell carcinoma. And the spoke wheel vascularity raises the suspicion for an oncocytoma, but can also be seen with the renal cell carcinoma. Now we are going to discuss another benign renal neoplasm, that is the multilocular cystic nephroma. It is a benign renal neoplasm that is composed of multiple large non-communicating cystic spaces, and it is an encapsulated lesion that contains no differential renal tissues and tends to afflict young boys and older women. Although a mass that is composed of multiple various sized cysts is a characteristic of multilocular cystic nephroma, but these findings can also be exhibited by the cystic renal cell carcinomas and by the cystic Williams tumors. Now, in this case, we can see a multilocular cystic nephroma, and it shows a very complex, predominantly cystic space that is covering most of the renal parenchyma. And here we can see a similar structure that shows multiple cystic species that are separated by multiple internal thick septa. Its differential diagnosis may be hemorrhagic cyst, infected cyst, multiseptate cyst, abscess, hematoma, cystic renal cell carcinoma, or multilocular cystic nephroma.